Okay, good evening. So for the writing OET, so today I'm going to discuss to you the writing subtest structure. So in the writing, you will be given a task to write a letter. So the task is normally asking you to write a letter, a referral letter. Sometimes a different type of letter is required, like a letter of transfer or discharge, or a letter to advise, or inform a patient, care, or group. So normally, what particular scenario that you will be asked to write a referral letter? So normally, you will be writing a referral letter rather, if your patient needs further management by another healthcare professional, such as um, you need to refer your patient to the GP or to the doctor, or physiotherapy, or a dietitian for dietary program or nutrition program. Okay, normally asking you to write a letter that you're going to refer your patient, for instance, to a physiotherapy for exercise program. So it's like that. Now, what particular case that you will be going to write a transfer letter? So please take down notes on this. Transfer letter is that normally if your patient needs to be transferred from one facility to another facility. For example, if your patient is having a cancer and then is he or she is admitted in the primary hospital. So let's say your hospital is just only a primary hospital, and then your patient requires further evaluation or laboratory diagnosis. So most likely, if your patient has a cancer, so he or she needs to undergo biopsy or CT scan. So you need to transfer your patient to the, let's say, tertiary hospital. So you're going to write a transfer letter. Or, for example, if it's only in one hospital and then your patient is getting worse, or your patient situation is getting worse. So for instance, it is from the ward going to ICU. So you're going to write a letter of transfer, so that you have to explain in your letter why your patient needs to be transferred to ICU. Okay, so that's it. Or the other way around, from ICU to ward. So maybe your patient is now stable and has progress. Okay, so needs to be transferred to ward. Okay, now normally patient has get recovered or get okay, so you need to write a discharge letter. So most likely your patient is from your hospital and going home, or from your hospital going to home care. So that is a discharge letter. Now, a letter to advise, normally at cases like this, you most cases that you are asked to write a letter of advice is that if, for example, you are a school nurse and then one of the student needs further management, or you need to call the attention of the parents, so you need to write a letter to the parents and give some advices or suggestions that what the parents needs to do with his or her child or their child. Okay, and then sometimes you will be asked to write a letter, inform a patient or a care or group. So for example, your patient is need monitoring at home and need someone to look after. So you're going to write a letter to the next of kin, let's say relatives, or to the care of the patient. So that's normally the scenario. Okay, now along with the task instruction, you will receive stimulus material, that is what we call the case notes, and or other related documentation, which include information to use in your response. Okay, now so, how is writing ability assessed in OET? Okay. So the writing has criteria to be followed, and then there will be two different assessors would mark your score or give you a score. Neither assessors know what score the other has given you or what score you have achieved on any of the other subtests. So your performance is scored against six criteria actually, and receive a band score for each criterion. Okay, so we have here first is the purpose. Purpose, second, content, please copy, and then conciseness and clarity, genre and style, and then organization and layout. And next we have the language. Oh, sorry for that. Now I'm going to explain to you what you need to expect under purpose. Now, in the purpose, you have to get a good grade under purpose criterion. You need to, okay, first body paragraph. It should be clear what is the purpose of your letter. Why are you writing a letter? And the content should be, please take note, the content should be the chief complaint of your patient, why your patient has been admitted in your hospital, okay, or at your hospital, and then what is the current status of your patient, and then you state there why you're writing a letter. Okay, for example, the first paragraph of your letter, you're going to say like this: I am writing to you today to refer patient X, or let's say Mr. Ramamorte, who is now being discharged from hospital into your care. All right, so that's how you're going to say. And then you want to state the reason why he was admitted. Mr. Ramamorte was contracted pneumonia and he is now fully recovered. Okay, so that's you are stating in that case, you're stating what's the reason or what's the reason why he was admitted in the hospital. And at the same time, you are also stating his current status. All right, so that should be the purpose. That should be on the first paragraph. Okay, that's your first. And also, the purpose also should be reiterated in the last paragraph. Last paragraph. Okay, so in the last paragraph. So here in the last paragraph, this is where you're going to enumerate all the tasks that your recipient needs to do with your patient. Okay, so you can find all those tasks under nursing management or assessment or nursing progress, and then at the same time under the section of discharge plan. Please take note. Okay, so the purpose must be clear, okay, so that your recipient must know what he or she needs to do or expected to do with your client. So you have to state that in your first paragraph by saying like this, and then the last paragraph, you're going to enumerate all the tasks that he or she needs to do to your client. Okay, so this criterion therefore examine how clearly the writing communicates the purpose of the document to the reader. So the purpose for writing should be introduced early in the document and then clearly expanded on later. And then the purpose should be easily and immediately identifiable to the reader, so there is no need to search for it. Next, the second criterion, we have the content. So the content should be the relevant case notes that your recipient needs to know related to your patient's current situation. So for example, our patient is Mr. Ramamorte, who had uh, contracted pneumonia. So the reason why he was admitted in the hospital is because of the pneumonia. So you have to include all the case notes that are related to his case. Okay, what are the medicine that been given while or during hospitalization? What are the things has been done during hospitalization? Also, upon admission, what were the symptoms or what was the patient experience upon, or patient's complaint upon admission or on admission. So those are the content should be included in your letter. Now take note of this. The case are different, okay? You might be encountering different case during our exercises. So you may encounter tasks that asking you to write a referral letter or discharge letter or transfer letter. And then mind this, that there is no fixed or standard format to follow. So you really have to analyze what is this. You have to understand what is the current situation your patient. So now when you're going to arrange the case notes, it should be according to its priority, and you have to remember what is the current situation or what is the diagnosis of your patient. Okay. All right. Anyway, I'll show you example later on. Now, if you have question, please raise your hand and turn your mic on, or you can just type your question on our chat box. Okay, so the content, once again, it should be related to the current situation, and it should be appropriate to the reader. So for example, if your reader is a nurse, so all the tasks that the nurse should do, or that the nurse, or all the tasks for nurses should be included in your letter. So let's say sometimes there's also a task for the physiotherapy and the dietitian. It's not really included. If you are, it shouldn't be included in your letter if you are asked to write a letter to a nurse, of course. So those are what we call distractors. Okay. So it is important that you need to know who is the reader, and you ask yourself, are these case notes necessary for the reader, or the readers, do you think the reader requires to know this or needs to know this particular information? Is this related to my patient's situation or current situation? So those are the things that you have to ask so that you can pick the right case notes, and that would fall under your content criterion. Don't forget that. Now, the third criterion is what we have: conciseness and clarity. Now, the examiner would check what are the irrelevant information that you have included in your case notes. If there's any, then therefore your conciseness will be affected. And take note also, there are some case notes that are in a different section, but they are related. For instance, talking about weight, for instance, in the social history, Mr. Ramamorte had gained weight due to poor diet, or due to eating more junk food. So he gained weight, but then during hospitalization, he lost 3 kilograms. So that's under nursing management. That's in another section. So as you can see, there are two case notes coming from different section, but they are related. So that's you have to connect that one. Okay, you're going to make a summary related to Mr. Ramamorte's weight. Okay, so you're going to say, on admission, Mr. Ramamorte had gained weight due to poor nutrition or poor diet, but after the review by dietitian, his weight has been managed and he lost about 3 kilograms. Okay, so those case notes were coming from different section, but we summarize them, and that would fall under clarity. So the examiner would check if you know how to summarize some case notes or some information. Okay, and how clearly this summary is presented to the reader. All right, but then again, you have to analyze first, are these case notes necessary or needed by my reader or by my recipient? So you have to ask first before you ask yourself first before you include that in your case notes. Okay, now, so that's clarity. Now, under genre and style, Don't forget, this is a formal letter. You are writing a formal letter. So you have to use the right tone, okay? Do not just simply say, for example, your task is asking your reader, or let's say your recipient, to monitor his intake and output. Okay? In the case notes, it's only say record, intake, and output. So you're going to transform that into a sentence. Okay, how would you transform that in a formal tone or in a polite tone? So you would say, um, it would be highly appreciated that if you can record, or please take note, or please or kindly record the intake and output of Mr. Ramamorte. All right. So those are the phrases that you can use. So you have to be polite, and then do not just say, uh, don't forget to record the intake and output of Mr. Ramamorte. It doesn't sounds right. Okay, you are requesting your recipient to do something to your patient, so like you have to be polite when you ask someone to do something on behalf of you, okay, in behalf of your patient. Now, by the way, you know the difference between um on behalf and in behalf. When we say on behalf, so that means you are the representative. Okay, for example, I am here on behalf of International English to give you this information. So I am the representative. That's why I use on behalf. Now, when are we going to use in behalf? So when we say in behalf, for the sake of, okay, in behalf means for the sake of. So you're going to say, so you have to write a letter in behalf of your patient for his management or further management or continued care at home. So, para sa kaayuhan niya. So those are the difference between on behalf and in behalf. Now, also another thing under genre, if you are asked to write a letter to the dietitian, or let's say to the social worker, so avoid using nursing abbreviations. Do not use non-standard abbreviations because your recipient might not understand what you're trying to say, unless if you are writing a letter to your to another nurse, so you can use nursing abbreviation. Okay, so that's also genre. Now let's say if you are asked to write a letter to the parents, so let's say you are a nurse or a school nurse rather, and then you need to inform the parents of that particular student what happened during at school, or you're going to inform the parents regarding the student's health condition. So avoid using medical terms, okay? Minimizing medical jargon. So that's genre. Now the style, don't forget, this is a this is a formal letter. So there should be date, the heading, salutation, dear blank, and then reference or regarding your patient. And then after which, your first paragraph, that's where you're going to write the purpose of your letter. What's the purpose? So under the first paragraph is that this is where you're going to state what's the chief complaint of your patient, and then what's the reason why you're writing a letter, and then what's the current status of your patient. Okay, and then don't forget to conclude your letter, and then use the right closing, and then you don't need to affix your signature or write your name. Just write what's your job or what's your title on the scenario. So for example, it says you are the nurse or you are the charge nurse in the ward. So you're going to write under closing charge nurse. Okay? No need to write Rochelle Brown, charge nurse. No need. Okay, now, so that's for the genre and style, organization and layout. Take note, case notes are not in chronological order. Okay? So your challenge, your task is to organize them according to its category. All right. So once again, how to organize them? You should know what are the priorities. So it should be from the top priority, second priority, and the least priority. So those are the things that you're going to write in your body. So first paragraph, please write down purpose, and then second is the second priority. Let's say you're going to write what happened upon admission, and then after 1 week what happened. So he or she progressed or needs further evaluation, or still have some experiencing some dry cough because he was admitted with the diagnosis of pneumonia. Okay, so layout. Okay, now the layout, again, you have to follow the formal style. Oh, same lang na sila. They are the same. Okay? Next. The language. Don't forget, this is a language test. So vocabulary will be checked. So avoid repetitions of words. And then again, vocabulary is also related to the genre, because the tone and the word that you're going to use in your letter should be appropriate for your reader. So for example, if your reader or your recipient is not a medical practitioner, so you don't need to use medical jargon terms. So use lame terms. Okay, if you have the same discipline of practice, okay, so you can use what they call this, abbreviation, okay, that you're going to that you're using. But if you don't have the same uh similar discipline, okay, so do not use what they call this jargon terms. Okay, so like the use of abbreviation should not be overdone, therefore assuming common prior knowledge. So if written to a medical colleague in a similar discipline, then judicious use of abbreviation and technical terms would be entirely appropriate. Okay lang yan. But if medical colleague was in a totally different discipline, or a letter was from a specialist to GP, more explanation and less shorthand would be desirable. No abbreviation. All right, now the language again, vocab. So that is related to the genre and the tone. Now, the grammar, you need to know when to use past tense, present tense, future tense. Then the spelling is also important, and the proper punctuation. All right, so those are the things that you need to know what so that you know what to do on your actual writing test. So don't forget those six criteria. Please don't forget them. First, we have purpose, content, conciseness and clarity, genre and style, organization and layout, then language. All right, so those are the six criteria for writing subtests. So question is handwriting assessed? Actually, it is not, okay? But if your handwriting cannot be read, so the examiner cannot give you a grade. How would a reader or the examiner can give you a grade if cannot be read, if your writing is not okay? So the assessors will accept either cursive or printed or fully capitalized writing as long as it's clear and consistent. But I don't really encourage this full capital letters. Okay? To be safe on your part, because this is a language test, learn learn or study when to use capital letter. You should know that when to use capital letter. Okay? Capital letter is only used for proper nouns such as name of place, person, title of the person, events. All right? So, if you are someone who prefers to write everything in capitals, then you need to write everything in capitals. But don't change halfway through, as this will confuse the assessor about your ability to use punctuation correctly. Now, so if you're going to use capital letters, sometimes we don't know when to use punctuations. That's why I don't encourage capital letter, because remember, you are being assessed in your language. Okay? Next, being comfortable with what you write with. All right. Now, question is, what are we going to use? Can we use pen or are we going to use pencil? Any. Okay, any, as long as you're comfortable. So think about what you write with as well. So you can write with pen or pencil, whichever is most comfortable to you. If it's a pencil, make sure it's sharp, as this will be clearer to read. If it's a pen, choose thin tip, as this will also be clear to read. Now, I want you to use pencil, and then please bring extra pencil, because you don't need to, or you don't want to waste your time for just sharpening your pencil in the middle of the test. So, and also the advantage of using pencil is that if you encounter, or if you make mistake, you can erase it. While pen, you cannot erase, so your writing would look messy. Okay, so these are the things that you need to do. All right, as soon as you receive your writing question, quickly read the task carefully. Okay, I'll show you where it's that. Normally that is on the last part of your case notes. Interpret case notes correctly, select relevant case notes, transform case notes accurately, and organize your writing logically. These are the 5 guides that you need to remember. Okay, so the task is on the last part of your case notes. Then after that, you quickly check what are the case notes that you need to include in your letter, and then try to interpret that, because some case notes are not written in complete sentence, or it's actually not some but all. And then it is not written in words, it's written in symbols, so you should know what's that it means. So you're going to transform that, and then, yes, select and then interpret. Transform, once you selected and after interpreted, you transform. That means you're going to write this time a complete sentence, because not all of the case notes are in not in a sentence form. It's in a bullet form. So this is also your challenge. You're going to write sentence. Organize your writing logically. So some case notes, there are a series of events. So you should know which is the most important. And then you should know the dates also, because you cannot mention the latest, then you go back to the earliest event. So it should be in chronological event. Okay, so I'll show you sample later, don't worry. But if you have question now, you want to raise your hand or write it on our chat box, and I would be happy to answer that. So now, please take note that these 5 guides are not necessarily step by step. Okay, you will need to refer back to each part of the method a number of times throughout the duration of the test. Okay, now, first, read the task. How? Where is that? Now, you will have 45 minutes on the actual writing or in the entire writing test. The first 5 minutes is only strictly for reading. You're not allowed to write anything during the first 5 minutes. And so you have to think this time by just remembering those case notes that you need to include in your letter. Do not write or highlight them during the first 5 minutes. Then, after that, you will be given 40 minutes for you to write this time your letter. Okay? So, the first thing that you should do, the first 5 minutes reading time, is read the task carefully. So, during your first 5 minutes, you can quickly check what is the task. The task is located at the bottom of the case notes and looks like this. Okay, so that's the task. Now, using the information in the case notes, write a letter. So it did not tell you what kind of letter is that. It's either a referral letter, discharge, or transfer. Now you have to remember who is the reader, who is the recipient of your letter. So Miss Samantha Bruin, who is she? She's the senior nurse of where? At the Gray Walls Nursing Home, 27 Station Road, Gray Walls. What does she needs to do? She will be responsible for Mr. Baker's continued care at the nursing home. So you have to think, what does Miss Samantha needs to do with Mr. Baker? So Mr. Baker requires further help or further care at the nursing home, but this time it would be Samantha Bruin. Okay? So then you go to the case notes, you have to check there, what does he needs? Ano ba kailangan ni Mr. Baker? Bakit pa siya kailangan ng continued care? You have to read on the case notes if he has fully recovered or if he is still not able to do some activity of daily living such as toileting or showering. So, kaya kailangan niyang mag-ask ng help from Miss Samantha Bruin. So, those are the things that you have to check. Bakit kailangan pa ni Mr. Baker ang assistance ni Miss Samantha, or it's either to monitor his medication, so it's, or you would ask Miss Samantha to make sure that Mr. Baker is compliant with his medication. Okay, so that's how you read. And then after that, you have to check the recipient's name, recipient's position, profession, the recipient place of work and address, and a reference to what type of letter you must write. In this case, on that case, it does not tell us what type of letter that we're going to use. Okay? So you have to analyze. So discharge si Mr. Baker from hospital going to nursing home. So it's most likely it's a discharge letter. It's not a referral letter. Okay, how would you know if it is a referral letter? Okay, sa case ni Mr. Baker, maybe he's already living at that nursing home, na-admit siya sa hospital ninyo, and then go back to the nursing home. Okay, so that's discharge. But if he's from his house going to your hospital and going to the nursing home, so most likely it is a referral letter. Okay, can you see the, what they call this, the scenario? So just simply analyze the situation or the scenario. Okay, you can also see or infer from the task whether the recipient knows the patient. Okay, so you have to check, does Mrs. Bruin, okay, knows already Mr. Baker, or do I need to introduce Mr. Baker to Miss Bruin for the first time? So knowing this information is very critical for case note selection. So we can infer that Miss Bruin knows Mr. Baker already. Bakit kaya? I don't have sample here. Wait lang, I'll check. Okay, here it is. I'll share it to you. My question, Vianney, Gianna, AJ, Nino. Nosebleed. Pag write mo, you write while I'm discussing. Okay? Take notes. If I'm too fast, you have to tell me, Mom, you're too fast. Just message me privately. I'll slow down it for you. Okay, now I'm going to show you a sample about the case of Mr. Baker. All right. And so here is the task. So how would we know if Miss Bruin already know or knows already Mr. Baker? So that's the address of Miss Bruin, Gray Walls Nursing Home. So we go to the patient details. Okay. So our patient is Mr. Baker, 79-year-old, widow, was admitted on September 3, 2018 at City Hospital and discharged on 7 September 2018. The reason for admission, he had left total hip replacement. Okay, that is elective surgery. And then also he had terrible osteoarthritis. So he had difficulty of mobilizing and climbing stairs. Now, let's check the social background. Mr. Baker lives at Grey Walls Nursing Home. So, for 4 years, therefore, Miss Bruin already knew Mr. Baker. So, therefore, hence, you don't need to introduce Mr. Baker to Miss Bruin. In other words, you don't need the social background. You don't need to include that in your letter. So, what do we need to introduce to or include in our letter? What's the case